think what they meant was.
What time is it?
What they meant was bring.
You're getting so confused on the
Is it on?
linguistics of the
Hello and welcome to Opportunity Home San Antonio Special Board Meeting. Please note this meeting will be recorded in its entirety. I will now conduct roll call. Chair, Gabriel Lopez.
Here.
Committee Chair, Gilbert Casillas.
Here.
Commissioner Barbara Uncoma-Burford.
Here.
Commissioner Dalia Contreras. Commissioner Estrella Garcia Diaz.
Here.
Commissioner Janet Garcia.
Here.
Commissioner Leela Powell. Doug Ponick, Board of Commissioners Attorney.
I'm here.
Acting President and CEO, Michael Reyes.
Here.
Additionally, we have an interpreter located towards the back of the room should you need their support. You may now call the meeting to order.
Thank you. The Board of Commissioners or its committee may hold a closed meeting pursuant to Texas Government Code 551.071-076 for consultation concerning attorney-client matters, real estate, litigation, personnel, and security matters. The board or committee reserves a right to enter into closed meeting at any time during the course of the meeting. I want to remind everyone that this is now a special board meeting. Do we have any citizens to be heard?
Yes, we have 2 citizens signed up to speak. Please note, now is the time for citizens to be heard. Citizens will be given up to 3 minutes to speak. And note, the board will not discuss the comments of the speakers or respond to speakers during the citizens to be heard portion of the agenda. Our first speaker is Kane Clavizio.
Good afternoon. My issues are the security, the front door and the back door, and the gate for the parking lot. The other issue is the laundromat, which I believe should be 24-hour access with a key showing that the name of the residents that's going in and out and the time they go in and out. And that's it. No, there's one other issue, and that is the notice, the 24-hour notice for the spray and the inspections. They never happen. So I just want to bring those 3 issues up.
Thank you.
Thank you.
Our next speaker is Benita Johnson.
Hi, I'm Benita Johnson, and my main purpose is the security around here. I don't feel safe. We got key fobs. They're no good. We got people coming in and out anyway. It's just, we need security around here because I don't feel safe, and I'm quite sure that my residents don't feel safe at all also. Thank you.
Thank you.
That concludes the citizens signed up to speak.
Okay, we'll move to item number 3, consideration and approval regarding Resolution 6581, authorizing the Augusta Flats transaction, including authorizing the Las Vadas Public Facility Corporation to approve Resolution 24 LVPFC-09-17, authorizing its participation in the Augusta Flats transaction. Timothy Alcott, Executive Vice President, Development and General Counsel. Board members, we will take a vote after this one item in order to move it further along.
Jumping in, as Chairman Lopez mentioned, this is an agenda item we're asked to take action on. And the reason is this, the Lynn Company, which is a local developer, they are buying this apartment complex with or without us. And they approached us and said, would you like to be a partner in it? We had some experience with the Lynn Company. We closed Calabria Crossing, Josephine and Petrenko with them. Calabria Crossing was very successful. And Diana, you have to help me with the numbers here, but we were projected to get how much money on that project originally?
5 million in 5 years, and we got over 7 in 2.
Yeah. So, our first PFC deal, we did with them, it was very successful. We have 2 other ones that are under construction, and those PFC stands for Public Facility Corporations. And one's on Josephine, right down by the Pearl area. And the other one's on Petrenko. It's called Petrenko. So easy to remember what that one is. But Lynn's a local developer, as I mentioned. They have offices at Northwest Military in 1604. They have about 6,700 units they manage. They, have done over $1.8 billion worth of development, San Antonio, Austin, Denver, Miami. They've had, as I mentioned before, they had success with us. The other thing that's interesting about this, the equity person on this project, who would be the equity on our project, his name's David Rubenstein. He's the owner of the Baltimore Oilers and chairman of Duke University. He started the Carlyle Group. So he's the equity investor on this project. But let me switch this. Go back to my slideshow here. But anyway, that's the main players in this project. And they've had lots of success. And so what we do on these projects, when we talk to you, there'll be 3 main types of projects, because I haven't spoken to the entire new board in a while, that we'll talk about. There's typically, we do PFC deals, which is Public Facility Corporation deals. We do 4% and 9%, and each one has a different purpose. The 9%, those are ones we get a large subsidy from the federal government, so we can build very deeply affordable units. And so you see a lot of units in there, that are 0 to 30% AMI. So people that are truly low income. The next type of developments we'll bring to you are called 4% transactions. And 4% transactions that, you can do some income averaging, but the average AMI or income for those units is about 60% AMI. So we normally have some deeply affordable, we have some a little bit higher, but it's a little bit more workforce housing. The third type that we haven't done very many of and is the PFC transactions, and that's one of these. And the reason that these are successful for us is that we do have it's 50% market rate, 10% of the units serve 60% AMI, and then 40% AMI. But what we do is we have a development policy, which, most of the board, I don't know, Ms. Buford, you're very new here, but we do have a development policy. We can go over it with you. But part of it's on this screen here. And it's very important because whenever we build very low income units and people are making $10,000 a year, if it's $10,000 a year just pays for the staff on site, but not the cost of the building. So when people ask me, what's the gap on a public housing development? It's the cost of the construction. And I won't go too long here, but so this is how do we get the money to get that? Because we don't get it from the federal government. This is one of the ways we do that. And so whenever we do one of these developments, you'll see that we have our development policy and it says 30% of the units will be set aside for creating new units at 50% AMI or below. So we can actually buy down the rents. And also we use it in our policy for buying land in the future. If we're going to redevelop a new public housing development, we may need to move folks around. So we put some funds there, 30% of it. We also put 30% into preserving or upgrading our current public housing units because we get capital fund, Hector Martinez, but he oversees that, but we only see $12 to $14 million a year. And we have hundreds of millions of dollars worth of deferred maintenance. We also put 30% into supportive services. That goes to job placement, financial literacy, risk mitigation fund, which helps with evictions. And then we put 10% into reserves. So that's what the previous boards, have put forward. And so not only are you getting a new development, you also are putting money to the side for these different groups. This is where it is. It's called Augusta Flats. If you, on your computer, you can Google it. It's a beautiful development. Happen to know Gabe Lopez has been there and has toured it as well. It's a Class A development. We have, there's a picture of it, and you'll see that we have some units at 60% AMI, some at 80% AMI. The amenities are well done. It has structured parking. And so it has 372 units of structured parking. So it's, the development, as I mentioned, is 260 units. And so we talked to the property manager when we walked it, and he said, we actually on the top floor, because it's not covered, it's actually not all used. So actually, they try and have events there. But one of the reasons, because a lot of deals are brought to us that we like this particular one, it's very hard for a housing authority to get land near downtown, especially a Class A development, because they cost too much. And so this is one we said, listen, people can walk to work. It's 0 to 3 bedrooms are the size of the units. Actually 0 to 2 bedroom units. So that, so it's a lot of workforce housing, people walking, to downtown. There's a lot of amenities there. It's a 2-story gym. It has a roof terrace, clubhouse, pool, outdoor grilling. So on these deals, we don't put any capital into it. What we bring forward is the tax exemption. Here's the projected revenue that we would have. So we receive $250,000 up front. And if I didn't explain this, clearly, they're going to close on this next month. And there's a lot of documents that you have to prepare when you have a closing, the partnership agreements and things of that nature. And that's why we're bringing it to you as a special board meeting. And so we'd likely see, that funding next month. We also received 25% of the annual tax savings. We negotiated this up to yesterday. So we got that solidified, and so you'll see the numbers there. We also, every time it sells, so the Lynn Company, as Diana mentioned earlier, they had sold that very quickly. Every time it sells, we get 2% of the gross sales price. And to be conservative, because it's very important that I do that, as far as funding, you can see on this, we projected 2 sales. And that would be, the expected revenue that we would receive. So what else we have? That's it. So what I would ask is, I'll answer any questions, but I'd ask for approval of this transaction. We typically do these through an affiliated entity. So there is also the Las Vegas Public Facility Corporation on here as agenda item. Both would be approving the same thing. I did talk to Leila Powell, and she is also in favor of the project, just as an FYI. So I ask for your approval.
Mr. Chairman, if I can add to Tim's presentation, he mentioned the proceeds of this development. He mentioned the 4 buckets. We've heard from the community the need to build deeply affordable units. This is the way to get there. This is the way you need to make money in order to build units. Second, we talked about the need for capital improvements at our aging properties from 1937 to now. We know we have $500 million worth of capital investments that are needed. Billion with a B, $500 million worth. This is the way to get there to help maintain those units and keep them preserved. We talked about the effects of the pandemic and families still hurting. And, this organization creating its first ever emergency rental assistance program. This is the way to fund that program. So there's many pluses in terms of proceeding with this development. One, it produces more affordable housing in the city, and it helps this organization to stay financially viable and maintain our important affordable housing stock.
Thank you. Any questions, commissioners? Okay, with none, I'll accept a motion to approve this item. Resolution number, item number 3.
So moved.
Second.
We have a first and a second. All in favor? Aye. Any opposed? Individual item, Resolution 6581 passes. With that, I will adjourn the special board meeting temporarily so that we can go to the Las Vegas Public Facility Corporation, as this is that other half of the same transaction. We do not need to do a roll call, is that correct?
No.
Okay. Then we will go to, call the meeting to order. Are there any citizens to be heard for Las Vegas?
There are no citizens signed up to speak.
Okay. With that being said, we have an approval of the September 4, 2024 Las Vegas Public Facility Corporation meeting minutes. Unless we have any questions, I'll take a motion to approve those minutes.
So moved.
Second?
Second.
We have a first and a second. All in favor? Aye. Any opposed? The minutes are approved. We have one consent item that was just approved in the special board meeting. It's consideration approval regarding Resolution 24 LVPFC-001 09-17, authorizing the Augusta Flats transaction. With no presentation needed on this item, and if there are no questions, if there are no questions, I'll take a motion to approve that resolution.
So move.
We have a first, we have a second?
Second.
We have a first and a second. All in favor?
Aye.
Any opposed? That item is approved. I'll take a motion to adjourn the Las Flores Public Facility Corporation meeting.
Motion to adjourn.
Okay, we have a first, we have a second?
Second.
First and a second. All in favor?
Aye.
Aye. Any opposed? Las Flores Public Facility Corporation is adjourned at 1:20. Vice Chair will take over.
I now call the special board meeting back to order. Move to consideration item number 4. Consideration and approval, appropriate action regarding Resolution 6583, authorizing the acting president and CEO to approve and proceed with various providers of employee primary health plans to include medical, dental, and vision plans. Other employer-provided plans provide for short-term disability, long-term disability, life insurance, and ancillary benefit plans, and an electronic benefits enrollment platform for calendar year of 2025 at a projected cost to the employee and employer of $11,722,000 and $398. Ayana Longoria, Director of Human Resources.
Good afternoon, Commissioners. So I'd like to first introduce our guests from McGriff. They are our benefits consultant that helps us identify our plans every year and helps us through this process. We have with us Judy May and Heather Kennedy. So again, if there's any questions I can't answer, I may be looking back there in a panic, but I think I've got this because they have been helping us, as I mentioned, throughout this process. So as you did state, we're here to seek approval for our employee medical dental, and these are provided by Blue Cross Blue Shield. Our vision is provided by Humana Dental. Our employee benefits, long-term, short-term disability, life insurance, accidental death, dismemberment, and our EAP are all covered by Opportunity Home San Antonio. We do have a third-party administrator for our ADA FMLA. We have a benefits enrollment portal, and we'll go through all of these as I go through the presentation. And of course, our wellness programs that all will cover. So just as a way of a background, in 2023, so just last year, McGriff did issue an RFP to ensure that our health services were competitive among the marketplace, see what the rates were going in at. And Blue Cross Blue Shield prevailed as our most responsive bidder for our medical and dental. However, in the process, we found Humana Vision was going to give us a better rate and better coverage option than Avisus. So we did change plans last year to Avisus. And then we brought in a RAG Legal for our employees. And again, that's an optional that they have to select from. And then we added a new EAP called Deer Oaks, and that has been just an amazing game changer for us. But all of that to say, we are going to be continuing with those same providers going into 2025. We have two plans that are going to look almost identical in structure. Well, they are identical in structure, but they vary a little bit different in their coverage, and we'll go through those, and we'll get into the rates again as we go through this presentation. But what I want to make sure that is conveyed is that our win here was that we knew that the rates were going to be increasing. We knew, again, that this is just part of the health insurance is going to go up. But what we wanted to do was hear from our employees what was important to them, where their utilization was. And what's important here is what we'll be able to share, and what we're proud to share is that our plans are not going to change. And we'll talk a little bit about how we got to that point. So again, just the highlights of Blue Cross Blue Shield. They are a national network. So if our employees are traveling, if they're going anywhere, they will have coverage. It'll be out of network, but they will be covered. Of course, Blue Cross Blue Shield offers online services now, so they're available 24 hours, of course, hospitalization, home health, and behavioral health and substance abuse needs. And the pharmacy does continue to be robust with a 4-tier so that we get better pricing through the tier structure. And they also offer a mail order program, which we will be promoting going forward. So as I mentioned, we were going to talk about the plans. We've got the PPO 1000, which is what we call our low plan. And this is where the deductible is $1,000. And then anything past that is 80% co-insured. 100% preventative care for both the high and the low plan. On the high plan, we have a $750 employee deductible with the co-insurance being covered at 90%. The office copay for the low is $35. On the high, it's $40. Specialist is $40 for the low, $50 for the high. And then the urgent care copay is the same for both, $50. And again, that was an intentional. That would be being able to go to Texas Med Clinic at $50, again, regardless of what you're going to the urgent care for. And the emergency room is also the same for both at $350. Our dental did not change. And again, what we just saw in the medical did not change from the previous year. It is exactly the same. We're not touching anything. Our dental and vision, we're excited to say also has not changed. And so it does offer, again, because it's Blue Cross Blue Shield, in and out of network benefits, 100% preventative care. And it is one standard plan for all employees. And we have a $50 employee deductible with 80% of basic care coverage, past preventative, and 80% major care covered. On the vision, as I mentioned, we changed to Humana. And again, in and out of network benefits because they are a national level organized provider. $10 copay for an eye exam. And then the employee expense is $50 for a frame, $150 for contact lenses. And then they do something very different that we hadn't seen before, which is retinal imaging. And that is something that's a preventative tool that helps identify other potential medical issues that someone may have by just doing that scan. So again, just to summarize, our out-of-network is available for all of our employees because these are high-level providers. There are higher copays, but to be out-of-network, but also less co-insurance, so there was no change there. We have no plan changes, as I mentioned. I can't keep stressing that enough. I want to make sure everybody knows we did not change anything in our plans. We still offer the Livongo Diabetes Program, tobacco cessation, and we have a stop-loss protection program as well to support our health programs. So covering what's 100% employer provided, again, we have a basic life insurance that's provided by the organization, although employees do have the option to buy up if they want additional coverage. Also covered by us, accidental death, dismemberment, short-term disability, long-term disability. We have a flex spending account for employees to select from if they wish. And the employee assistance program, as I mentioned, with Deer Oaks this year has been great. And the other piece that we offer is that wellness, which is the gym and wellness app reimbursement, and then wellness events reimbursement. So employees have the option to submit for reimbursements twice a year for those programs. So looking at our plan administration, again, this is a lot to cover, I know, but we do have an electronic enrollment system called SmartBen. And what this does is it allows employees to enroll and manage their own selections throughout the open enrollment process. Of course, HR staff does provide training sessions. We provide information on the insurance, how to use the portal. And then, of course, if staff are not able to use the portal, we support them through the process because, again, we want to make sure all of our employees have access to coverage, even if it means declining it. We want to make sure they log into the system and let us know their options. Of course, Family and Medical Leave Act, we have to have that, and Americans with Disabilities Act. And of course, we ensure that we're compliant with the Affordable Care Act as well. Our voluntary benefits, and again, these are the ones that we provide that employees pay for. This is completely at their for their optional whether or not they want to choose, is the supplemental life, supplemental accidental death and dismemberment, just accident, critical illness, and of course the legal plan. So here's where we're getting into the nitty gritty. So our projected expenses in 2025, and so just a couple of things that I want to highlight here. So of course, the most significant portion of this is our health plan. And as we recognized, we knew the health premiums were going to be going up. But what we want to note here is that we are projecting our claims data on 12 months. And this is a change from what we've done in the past years, where we've usually done like a 3-year look back period to make a projection for the year going forward. What we've kind of felt this year is our benefits have been utilized very extensively this year. And we want to make sure that we're really capturing what is happening. And so by using the 12 months rather than the long look back, we're really a little bit more in step with the utilization. So we are trending a little higher. We knew we were going to be, but it was a conscious decision because we want to make sure that we're accounting for all, to just be as proactive, right, with this process as possible. So then the other piece that we also want to make sure that we note is that we're projecting enrollment of 526. Right now, our current enrollment for 2024 was 509. You'll see that on the next slide. But again, we wanted to project for a higher enrollment. Again, perhaps we are going to have new staff coming in that need our benefits or staff that may want to take advantage of our plans. So again, we want to make sure that we're covering for that possibility as well. And then again, I want to mention that we did explore the options of increasing the co-pays, the utilization, right, the point of service, like increasing those rates so that when an employee is using the service, they're going to pay more out of pocket as the way to cover those additional expenses that we might be facing. Again, looking at the pharmacy, the emergency room rate. But basically what we identified was the savings from that was not sufficient alone without having to increase. And again, really respecting and ensuring that staff continue to utilize the benefits, continue to know they have good coverage. We looked at just the straight rate increase without, again, as you notice, we didn't touch the plans. And so that was, again, a very important consideration that we wanted to look at the options, but didn't feel that they were strong enough to warrant doing that, almost double, negatively impacting our staff twice, right? Not only are you going to get a rate increase, but then also when you use it, it's going up. So we just went with the one. So again, this was the comparison to our prior year, and this is where you're going to see the increase in cost. And again, what I have to stress is that this is not a reflection of our organization. This is nothing that Opportunity Home specifically suffers from. This is something, again, industry-wide across the country. And pharmaceuticals are, again, the biggest expense that is driving this increase. And as you can see, our claims data was for, in 2024, was for 30 months prior, which had our look back at 2021. And I can't remember what I was doing last year, let alone in 2021. But if I recall, a lot of people were deferring healthcare. A lot of people were putting off those office visits and having to go to the doctor just because, we were being very cautious at that time. So again, that lack of use doesn't account for what we're doing now and what we're seeing now. So again, it made sense to move to the 12 months. So as these are the adjustments that we would need to hit the target of our funding. So we have 168 employees in that medical, what we call the high plan. And so where you'll see these rate increases down the line for 2025, that is per paycheck. So they're on the employee only, very reserved. But again, where we start to see the higher increases is when we get to the family coverage. And on the next slide, then this is the next plan that we have, what we call the low plan. And this is where we have the majority of our employees. We have 358 employees enrolled in this plan. And again, you'll see the increase are very modest for employees only, and then they go up to through the family. So they increase with each layer that's added. And what we do want to note is that, again, we were reserved with our lower plan because we wanted to ensure that there was an option for staff that are currently in the high plan to move down to the low plan to still have their needs met. So this last slide, you should have a copy in your packet of the sheet larger than this, so you'll be able to see. And again, what you'll see in this sheet is our 2024 benefits compared to our 2025 benefits, and you will see they are exactly the same. We did not change anything. So again, this is where we're really standing firm on the benefits and services that our employees are utilizing today. They will continue to use next year at the same levels, same rates. And so again, as I mentioned, there are no adjustments that we need to make to our dental or vision. So those are going to stay the same. So our plans are staying the same and our rates are staying the same. So that is really good news as well. And so the last piece that I want to get into is those data benchmarks, right? How do we come up with these numbers? How do we know what we're looking at and how we're doing? So what we looked at were similar sized organizations. We looked at government organizations and we looked at Texas-based organizations. And we get this data monthly, but we also meet quarterly again to identify the trends, what's happening out there, what are other organizations experiencing. And so what we've seen, of course, is the higher care needs cost, and this is because we're seeing advanced stages of illness that was preventable or could have been screened out earlier but wasn't caught. Of course, that increased in pharmaceutical costs, behavioral health needs, and less wellness overall, maybe more higher risk behavior like putting off preventative screenings. And so right here, what you'll see in this chart, that first PPO, so this is our low plan on the left-hand side, and that very first thing that says low, that is where our average per employee per year cost is for health insurance. And what you'll see is compared to similar size organizations, where that's trending, Texas-based organizations, and then public entities. And then you'll see those monthly rates for each of those. And again, what we know is that our plans are very rich. Our plans do offer a lot of benefits to our employees. So yes, so that was our ability to see how we were coming in. And where we really see this is at the bottom with the contribution to the premiums. Again, where employees are contributing 14%, at other organizations, they're contributing 19%, Texas-based organizations, 20%, public entities, 13%. So we're right in line with other public entities, and definitely, again, doing better than the market. And then lastly, I did want to touch on the well-being. So this is a change for us. We're taking an evolutionary step from just calling it wellness, because we recognize there's a lot more components to a healthy employee than just their health. And so what we've done is we're looking to identify advocates within our organization. And there have been a lot of employees that have stepped forward to say, I'd like to participate in some type of group or some type of committee. We want to talk about what our priorities are for wellness, whether it be financial, whether it be, again, work-life balance, whether it be educational needs, mental health needs, and then, come up with assignments and things for this committee to do. But we also have to have awareness. We want to make sure that staff understand HIPAA and safety. We want to identify if there's partners in the community that can also support us in this, and then use the tools that we already have, right? Our EAP is number one, like I said, is our number one driver for not just mental health, but also supportive services for our employees. And then the last is we want to make sure that we are including a campaign for all of our employees to put preventative health care, to do those screenings. We want to be part of the messaging that goes out, and we hear it a lot with breast cancer, with prostate cancer, with health, with heart disease. So we want to make sure that we're also taking advantage when those campaigns are coming out to promote that as well for our employees. Are there any questions? Oh, yes.
Let's just see.
Okay, what I would like to say, I understand everything you brought to our attention, but you left out, how about our wellness, our health here, and about,
The resident health and wellness.
yes, about animals in our apartment. And like, I'm disabled, so I'm supposed to fight the animals or what? Because if one company don't take care of it, there's another one that will, I mean, it's terrible. I've been here 25 years and never been through what I'm going through now. And I'm not getting no type of help.
Hey, thank you, ma'am. I appreciate those comments. And actually, probably what we'll do is we'll have a staff member speak with you, because the citizens to be heard portion expired already.
Excuse me. What is your name?
My name is Gabriel Lopez,
Okay.
and I'm a commissioner on the board here.
Okay.
I'm the current chair. The specific to the presentation that we received, that's actually the report on the employees of Opportunity Home, which needs to be done in an open meeting, which is why that's what you had heard. But if it's okay, I probably will have a staff member speak with you so that way they can get your
Yes.
concerns.
Because just like you shutting me down, that's the kind of help I'm getting, okay?
Mhm.
But I'm here to pay rent every month and abide by the rules, but just how you just shut me down, that's what I am getting, no help.
I understand.
No, you really, really, truly don't.
Okay.
And I wish this upon nobody, but you know, anybody could walk out this door and have an accident or whatever. And then you have to learn things, how to do things that you used to do, you know, all over again. And it's just hard. Yes.
Thank you. Thank you, ma'am.
This is my card, if you need to go.
Sorry for.
I just want to remind everybody that's here visiting today that this meeting, what's being presented to us has to do with business for the organization, employees, and some of it has to do with residents. But those of you that wanted to speak, you had the opportunity during residents to be heard at the beginning of the meeting. Any questions that are asked of, within the meeting have to do with from the board members to the staff member on what has been presented. So just to let you all know that it's not that we're trying to shut anybody down, but we're following parliamentary procedure on how this meeting is to be run. So, and if you have any questions, there are staff members here that would be glad to help you. Thank you. So with that, are there any questions from the board?
How many employees, just percentage-wise, utilize, say, the high plan versus the low plan currently or this past year?
So yes, we've got, let's see, out of the 400 employees, we've probably got about 25% in the high plan and 75% in the low plan. Yeah, I got that backwards. Sorry. It's 75% in the high
High
plan,
plan.
25% in the low plan. Oh, okay. I had it
You had it
right
right,
first time. Okay,
25 and
25%. It's 25, 75, yeah.
Does the increase track with, you said y'all did check others. I mean, this increase is about normal at 20% on healthcare costs?
Yes.
Okay.
Absolutely.
Okay.
I have a question. So, due to the increases, right, are employees at Opportunity Home able to afford that increase?
Yes, I'm glad you asked. That is one of the things that we have to make sure that we're measuring against the ACA. So we have to make sure that our plans are affordable at a minimum. So we do use our lowest, our entry rate of pay, which is $20 an hour. So we use that annual salary to ensure that we're competitive in the ACA.
Thank you.
Does Opportunity Home provide any incentives to employees to make sure they're taking advantage of the preventative screening that she's using?
No. At this time, we haven't, but that is something that we have talked about. Unfortunately, in order to do those, it does require a cost.
Yeah.
And we're not, we're not there just yet. And so again, we were going to start with, let's market, let's campaign, let's bring awareness first, and then incentivize.
Any other questions? I'll entertain a motion to move this forward to the board meeting for approval.
So moved.
I have a motion. Do I have a second?
Second.
I have a motion and a second. All in favor?
Aye.
Aye.
Any opposed, same sign? Motion carries. Item number 5, consideration and appropriate action regarding Resolution 6584, resolution in support of the Fourth Amendment to the Housing Authority of the City of San Antonio Employees Money Purchase Pension Plan and Trust, restated effective July 1st, 2021. This resolution amends the Employees Money Purchase Pension Plan, the AMPP, by adjusting an eligible employee service requirement for eligibility, entry dates, and the employer contribution amount. Ayana Longoria.
Thank you again. So I am here to talk about the plan. So our plan is our pension plan, and it is mandatory for all employees to participate in. And so our current plan was restated and approved July 1st, 2021. And since then, we have had 3 amendments so far. And the first one was effective December 17, 2021, and that was the change to provide contributions on behalf of our president and CEO. Our second amendment, which was effective April 2022, was that we wanted to incentivize our benefits package. And so we did do immediate entry upon hire. So it went from a 1-year waiting period to immediate entry upon the date of hire. And then our third amendment was that we increased the employer contributions on the plan from 7% to 11%. So what we're doing today is very simply rolling back amendments 2 and 3. We did those amendment changes because of what was happening in the labor market. We were faced with very competitive wages in the marketplace. We were faced with, trying to get new hires, getting staffed. And this was a way that we could provide some incentive for employees to take a second look at us. Even though they weren't thinking about retirement when they were coming to start with us, it definitely was something that we were using to attract candidates. So as I mentioned today, what we're doing is changing the entry dates. So now employees, new employees that start today will have to wait 12 months of service and have completed at least 1,000 hours in those 12 months. Rehires are a little different, and I do want to just make a small note that for them, they can join the plan. It would be based on the break between the last time they work, because then in their case, it would be based on the hours of service. So they wouldn't wait the full year. And again, the change on the employer contribution is that upon joining the plan, our contribution would be 7%. And regardless of when they join the plan, they will receive 7%. So if they were a former employee and they came back and they can start the plan early, they're still coming in at the 7%, not the 11. So those are those 2 changes. And then again, just some additional information. This is any employee that's hired on October 31st, if they start, they have to start on October 31st. They are in the plan at the 11%. On November 1st, we start 7%. And at 7%, I do want to note, again, this was something that we did make sure that we were still competitive as a benefit that we're offering. And we are 401k programs, which is what most employers offer, match between 3 and 6%. So again, being able to offer 7 is still really good. And again, we took this action at this time just due to the budget considerations that we have, kind of understanding the environment we're in, and that we don't need to kind of offer the 11% right now because we're really good right now with staffing. And Opportunity Homes Retirement Program, we do continue to offer this, which is mandatory, but then we also allow staff an optional voluntary 457B, which is a deferred compensation plan. And that only requires $10 to enter into that plan. Again, it's voluntary. Employees can take money from that plan throughout their tenure so they can continue to work. They can even take loans against it. And just as a quick note, we will be bringing that plan to the board next month. So you'll be hearing more about it. Are there any questions?
Any question from the board members? If no questions, I'll entertain a motion.
So moved.
We have a motion. Do I hear a second?
Second.
I have a motion and a second. All in favor?
Aye.
Any opposed? Same sign. Motion carries. Item number 6, consideration appropriate action regarding Resolution 6567, authorizing the award of a contract for banking and related services to Cullen Frost Bankers, NADBA Frost Bank, for a period of 1 year with the option to renew up to 4 additional 1-year terms. George Ayala, Director of Procurement, and Aaron Sladek, Director of Finance and Accounting.
Good afternoon, Commissioners. I just wanted to give you a little warning. I'm going to be up here for the next 8 resolutions, so bear with me. Hopefully, I don't get lost in my notes. But this resolution is asking for your authorization to enter into an agreement with Frost Bank. The purpose of this solicitation is that, as you know, Opportunity Home requires the service of a financial institution to provide traditional banking and related services for Opportunity Home and its affiliates. This include, but are not limited to, general accounting services, depository services, lockbox services, and wire and other funds transfer services. With regards to the solicitation, this solicitation was advertised on July 15th. We issued an RFP for banking services that closed on August 12th. This RFP was published on multiple websites and directly solicited to 155 institutions. At the conclusion of this solicitation, the solicitation period, we received one response. This response was evaluated on the following qualifications: qualifications and experience and quality assurance, capability to meet minimum requirements and banking features, transition plan and training, strength of financial institutions, Section 3 and SWIMBY plans, pricing. And because of this, staff is recommending the award of this services to Frost Bank. With regards to the financial impact, although Frost does have charges, Opportunity Home does have a way of paying these charges. Based on our savings plans, we do receive interest. Did you need a quorum, sir?
Yeah, I was going to say, we need to pause
Yes, sir.
while,
We lost our quorum.
I didn't hear she got up. We lost quorum. We'll take a quick break.
Present, but we are not,
Okay.
we are
Okay.
not.
Yeah,
Well,
you
you
can,
can present, but we can't vote.
we can't vote on it.
Okay, so like I was saying, even though we have, there are charges for some of the services that Frost provides. These charges are offset by our revenue that we get because of our savings accounts that we have with Frost. So because of this, we anticipate that there is no charge to us. I think that's it for us. Any questions?
Smoke them if you got them.
So you can continue on to the next item and then come back to vote on this item if you'd like to do that. It's up to you.
Can we?
Sure.
Yeah.
It's just that we're not in a technical meeting right now. We're filling the time.
Okay, we'll come back and take a vote for item 7. We'll move on to item 8, consideration and appropriate action regarding resolution 6572, authorizing the award of a contract for restroom renovations at Opportunity Homes Central Office. Oh, I'm sorry, item 7, reading the wrong one. Consideration and appropriate action regarding resolution 6571, authorizing the award of contracts for welding services organization-wide to EA Contractor LLC HABE, Lexar Contracting LLC HABE, and Precision Arc Welding Company LLC HABE for an annual cumulative amount not to exceed $2 million for a period of 1 year with the option to renew up to 4 additional one-year terms. George Ayala, Director of Procurement, Miranda Castro, Chief Asset Management Officer, and Ruth Bautista, Director of Public Housing.
Commissioners, this is one of our multi-year contracts that we have in order to continue with our operations of the organization. The purpose of this is that we require a contractor to provide welding service organizational-wide. These services will include, but are not limited to, welding of metal screen security doors and windows, metal fencing, metal staircases, and railings, door frames, piping, soldering, and repairing of aluminum metal. With regards to the solicitation process, this solicitation was advertised on July 22nd, where we issued out an IFP for welding services for organizational-wide. This closed on August 12th of this year. This IFP was published on multiple websites, directly solicited to 167 vendors. At the conclusion of this solicitation period, we did receive three bids which were evaluated on the following standard criteria, which is purchase price, reputation of the bidders, the bidder and the bidder's goods and services, the quality of the goods and services, including past performance, the extent of which the goods and services meet Opportunity Homes needs, the total long-term cost, and any other relevant criteria contained in this solicitation. Based on the quality of work required under this award, we are recommending that that we award to all respondents. The financial impact, this current award recommendation is not expected to exceed an annual cumulative amount of $2 million. This award, as I mentioned before, includes welding of metal, screen security doors and windows. And it's also going to be used throughout the organization for different types of services. Any questions?
Any questions? Okay, before we vote on this one, we'll go back to item number 6. As we lost quorum, we will now entertain a motion for consideration item number 6.
I'll make a motion that we approve resolution number 6567 and item 76571 if there are no other questions.
Do I hear a second?
Second.
All in favor, say aye.
Aye.
All opposed, same sign. Motion's carry.
Item number 8.
Item number 8, consideration and appropriate action regarding Resolution 6572, authorizing the award of a contract for restroom renovations at Opportunity Home Central Office to HD Supply Facilities Maintenance Ltd., a Florida limited partnership through Omnia Partners Public Sector for an amount not to exceed $329,969. George Ayala, Director of Procurement. Hector Martinez, Director of Construction Services.
Hey, Commissioners, this particular resolution is asking for your authorization for us to go ahead and engage in a contract with HD Supply. The background on this is Opportunity Home requires the services of a contractor to renovate our 6 first level of restrooms at central office. The renovation project will include, but is not limited to, the demolition and installation of new restroom partitions, toilets, urinals, new countertops, vanity sinks. In addition to this construction will include a private nursing room with lighting and electrical switches. The upgrades for this project will meet LEED consumption standards for water and electricity. And one of with regards to the solicitation process, this solicitation is being presented to you today using the approval formal solicitation process allowed by the U.S. Department of Housing and Urban Development to use cooperatives and interagency agreements to simplify and expedite the procurement process. So this particular company has been awarded a contract within our cooperatives that we are utilizing, Omnia Partners and Sourcewell. So we are allowed to utilize this contract with them. The financial impact, the current award recommendation for restroom renovation of Opportunity Home is not expected to exceed $329,969. And as I mentioned, the award includes renovation of the first level, the 6 first level restrooms at a central office. Any questions?
So this doesn't include the ones on the second floor then?
No, sir. Due to budgetary constraints, we're focusing on the first level, since those are usually where our residents come in, either for our central lobby or the front.
Okay. Any questions?
Actually, I do. And just to refresh my memory with regard to the co-op,
Yes,
these prices or this bid of the 329 plus, that is a competitive cost for this type of renovation within our market?
Yes, ma'am. So what happens is, even though we solicit from vendors that are already pre-awarded on a cooperative, we actually go out and look at pricing. So we actually got pricing from Home Depot, which is a sister company of HD Supply. In addition, HD Supply did contact several different vendors, which actually gave us pricing, and HD Supply brought us forward the lowest price. One of the things that I forgot to mention is that when we started looking at this contract, we wanted to give as many SWIMBYs, small minority woman-owned businesses, the opportunity to bid. So one of the requirements that we had for HD Supply is for them to solicit as many subcontractors as possible as well.
Okay, thank you.
Oh, sorry.
If I may add, the base price is $274,973. It's about $45,000 a restroom. I think that's a very competitive price. Yeah.
Thank you.
Any other questions? If there are no other questions, I entertain a motion.
So moved.
Do I hear a second?
Second.
We have a motion and a second. All in favor?
Aye.
Aye.
Any opposed? Motion carries. Item number 9, consideration and appropriate action regarding Resolution 6569, authorizing the award of a contract for tree trimming, pruning, and removal services to A&S Landscaping Services, HABE, Section 3, Business for an annual cumulative amount not to exceed $1 million for a period of 1 year, with the option to renew up to 4 additional 1-year terms. George Ayala, Miranda Castro, and Ruth Bautista.
Once again, Commissioners, this is one of our annual contracts that we're bringing forth for you, for your consideration. This contract is required for the services of a vendor to provide tree trimming, pruning, and removal tree services. And this is going to be used agency-wide. This contract shall have at least one certified or accredited arborist on staff to oversee all the projects and inspect all the work that is performed. With regards to the solicitation process, this solicitation was advertised on July 22nd, when Opportunity Home issued an IFB for tree trimming and pruning services. This closed on August 12th of 2024. It was published on multiple websites, directly solicited through 306 vendors, and at the conclusion, we received 4 bids. This particular bids were evaluated on the standard criteria, which is purchase price, reputation of bidders, the bidder and the bidder's goods and services, the quality of the goods and services, including past performance, the extent of which the goods and services meet Opportunity Home's needs, total long-term cost, and any other relevant factors that were considered in the solicitation document, like SWMB and Section 3. At this point, staff is recommending a contract to be awarded to A&S Landscaping Services, as they provide the lowest overall cost of the services. The financial impact, the current award recommendation for tree trimming, pruning, and removal services is not expected to exceed an annual cumulative amount of $1 million. This award, as I mentioned, includes tree trimming, pruning, and removal services. And as I mentioned, they have to be licensed and certified in these services as well. Any questions?
Any questions? Being that there are no questions, I'll entertain a motion.
So moved.
Second,
A second.
we have a motion and a second. All in favor?
Aye.
Aye. Aye.
Opposed, same sign. Motion carries. Item number 10, consideration and appropriate action regarding Resolution 6573, awarding the award of contracts for generator maintenance and repair services to Clifford Power Systems and Boddicker Ventures LLC DBA Divine Power Group for an annual cumulative amount not to exceed $1 million for a period of 1 year, with the option to renew up to 4 additional 1-year terms. George Ayala and Ruth Bautista.
Another one of our annual contracts. This particular contract will cover the services of a vendor to provide generator maintenance and repair services, to include preventive maintenance that is to be conducted on a monthly, semi-monthly, annual, and 2-year intervals. This vendor is also required to perform annual generator load bank testing, and as required by the City of San Antonio Fire Department, in compliance with National Fire Protection Association standards. So as you may know, Opportunity Home does have emergency generators presently in operations for medium to high-rise structures as a backup to electrical systems that turn automatically and meet individual buildings' required needs. So these are to assist whenever there's a power outage. These do kick in, and we do have them for elevators, the emergency lighting, and such. With regards to the solicitation process, this solicitation was advertised on July 3rd and concluded on July 25th. We had This was published on the same multiple websites that we're accustomed to, directly solicited to 28 vendors, and at the conclusion, we did receive 5 bids. They were evaluated on the standard criteria, which I just previously mentioned. And at this point, we are recommending that the contract be awarded to Clifford Power Systems and Divine Power Group, as they provide the lowest overall cost and best value. The financial impact, this current award recommendation for generator maintenance and repair and services is not expected to exceed $1 million. And as I mentioned, this includes maintenance and repair to include preventive maintenance and annual generator load bank testing. Any questions?
Any questions? There's no,
Actually, I have a question.
Yes, ma'am.
So when you say directly solicited to 28 vendors, these are vendors you send the solicitation to directly? Like, how are you finding these vendors?
So we have 2 different methods of attracting vendors. One is direct contact, that whenever they contact our offices or whenever we see them at expos, that's one of the vendors. We actually reach out to them and put them in our system. We currently use a procurement software called Bonfire. So that we register them, and automatically, whenever we receive a solicitation that might fall into their goods and services that they provide, they're automatically sent a notification. In addition to that, this particular e-procurement software is a nationwide software. So there is multiple vendors that have registered with other organizations that we reached out to. For example, this particular software does work with San Antonio ISD. They do work with Northside ISD and UT Health Science Centers as well. So we reach out to those as well. We also partner with our South Central Texas Regional Certification Agency, where we actually get those vendors involved in our procurement process as well, ma'am.
Thank you.
I have a question. So the generators are located in each property, or is there properties that are selected that require?
So I think, I don't know if Hector can answer that, but there are, so we do have some generators that are mostly in our mid and high-rise locations. But
Yes, thank you. So not every property has generators. The emergency generators are there. For example, here at Fair Avenue, we do have one. And if power is lost at the property, the emergency generator will provide power to the elevators and to emergency lighting only. So it gives people a safe way to get out of the building, to vacate the building, to come down to the ground floor, and to be able to operate the elevators. So not every property has one. Now, we are looking at we have some congressional funding that we're looking at purchasing generators for some properties. Fair Avenue is one of them, where emergency generators will provide more than power for the elevators and emergency lighting, so that people can come to their community room and have a place to operate their medical equipment if necessary, to have food, water, and restrooms. And so we're looking at going a little bit beyond those services at some properties.
Okay, thank you.
and I really think, go ahead.
Go ahead.
I really think that all our properties, especially senior properties with elevators, should have emergency generators to operate at least the elevators in case of an emergency. And we have some mid-rises without those generators.
I also wanted to say we should highly consider and have a plan for our senior citizens' properties, right? Since there is medical equipment being used, such as oxygen tanks, possibly a medical device that they need. So, thank you.
Just for my information and to understand historically this particular procurement process and the methodology, have we always assigned or given the contract to 2 contractors, or is this, and why do we do that? Since they're bidding for the entire scope of properties with the generator, like, just help me understand that.
So one of the things that we've found is that sometimes we get different, we do go out for what is called itemized pricing. So like, let's say we ask for an hourly rate, we can ask for
By property.
yeah, well, by property, and also checking on the actual work itself. So we actually get 2 vendors because we actually compete, we bid within the bid. So whenever we have a new a new generator that needs to be installed or purchased, we actually send that out to as many of the members of that bid as possible. So in some cases, you do have 3. We try to allocate as best as possible, but whenever we see high prices, like let's say, for example, $25,000 on a roofing project, we actually go with everybody and see if they can compete within that bid.
So it allows you competitive pricing
Yes, ma'am.
in the market after a contract's been awarded.
Yes, ma'am.
Okay, understand. Thank you.
Any other questions? There's no further questions. I'll entertain a motion.
So moved.
We have a
Second.
motion and a second. All in favor, say aye.
Aye.
Any opposed, same sign. Motion carries. Item number 11, consideration appropriate action regarding Resolution 6574, authorizing the award of contracts for moving and temporary storage to Armstrong Moving Solutions, San Antonio LLC, DBA The Armstrong Company, Davis Moving and Cleaning LLC, AABE, ESBE, MBE, SBE, and JTB LLC, HABE, for an annual cumulative amount not to exceed $1 million for a period of 1 year with the option to renew up to 4 additional 1-year terms. George Ayala, Miranda Castro, and Ruth Bautista.
So this is our last annual contract that we're bringing forward to you today. This contract is for moving and temporary storage. As you know, Opportunity Home requires the services of a contractor to provide us as needed moving and temporary services for tenant, personal property, and organization owned property and equipment. The services provided by the vendors should include, but are not limited to, on-site and off-site storage containers. With regards to the solicitation process, this solicitation was advertised for a period of 21 days from July 31st to August 21st of this year. It was published on multiple websites. It was also directly solicited to 226 vendors, which we received 5 bids. And it was evaluated on the standard evaluating criteria. At this time, staff is recommending a contract award to Armstrong Moving Solutions, San Antonio LLC, DBA The Armstrong Company, the Davis Moving and Cleaning LLC, and JTB LLC, as they submitted the lowest cost and provided this for these services. Sorry. With regards to the financial impact, we're not expecting this to exceed $1 million, this particular contract to exceed $1 million. And it does cover all the moving and temporary storage for tenant personnel at the property and for organization-owned property as well. Any questions?
Storage of tenant personal property. Why would we be storing?
So, and correct me if I'm wrong, but there's been times that we had to relocate for extended periods of time our residents. So when we relocate them to hotels, we actually had to take those their belongings and put them in a storage unit while we are fixing back the units that they were belong to.
Thank you. Any questions? Okay, being no questions, I call for a motion.
So moved.
We have a motion. Do I have a second?
Second.
With a motion and a second, all in favor, say aye.
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 Any opposed, same sign. Motion carries. Item number 12, consideration appropriate action regarding Resolution 6575, authorizing the award of a contract for a self-managed Phase 3 energy performance contract, an EPC, and rate reduction incentive, and RRI, project development and application services to Group 14 Engineering, EBE, SBE, WBE, through Brockton Housing Authority, for an amount not to exceed $816,300 for a period of 18 months. George Ayala, Director of Procurement, Hector Martinez, Director of Construction Services, and Michael Lopez, Construction and Sustainability Program Manager.
Thank you, Mr. Chair. So this is a request to enter into agreement with an engineering firm called Group 14. They're located in Denver, Colorado. We've been partnering with Group 14. We've done contracts with them for many years now in our EPC efforts. So let me go over what an EPC is. It stands for Energy Performance Contracting. Energy performance contracting is a financial method where we go to our public housing properties and install energy conservation measures, and we pay for those energy conservation measures, those improvements, with the savings that they provide. So you're paying for improvements today with savings that you get to recapture tomorrow from the energy performance. It also brings down our consumption, for energy and water consumption. And so Group 14 the first thing they did was establish a baseline of performance of how our properties perform in energy and water usage. And then we've done 2 phases of EPC. The first phase of EPC was 2016 at our 5 biggest properties. We've done another phase of EPC, which took us to just about all of our public housing properties, and we installed energy conservation measures. So it can be items as simple as threading on an aerator on a faucet in the kitchen and bathroom, LED light bulbs, more efficient ballasts and light fixtures, new toilets that are low flow. These things have significant impacts on our energy and water consumption at our properties. So it allows us to invest in improving our properties without tapping into our capital improvement budgets. And it also lowers our consumption. So we're being, a good partner with the city, the utilities, as far as how we perform at those properties. And so that's sort of what an APC is from a very high level. When we applied for and were awarded the Solar for All grant for $24 million, which we will be bringing to you in the future, we saw an opportunity to enter into a phase 3 EPC. And so we made a business decision. I recommended that we approach Group 14 through an existing cooperative agreement with Brockton, another housing authority, because they are not just our engineer on the first 2 EPC phases. They are our annual measurement and verification engineers. So every year they come out and they tour all the properties and they do an analysis on how the energy conservation measures are performing and tracking how much savings we're being able to recapture. We have met and exceeded our goals every single year of our EPC program. And so we saw an opportunity for a future phase EPC to go along with the Solar for All grant, and not just an EPC, but a rate reduction incentive program, which is a HUD program. So the thought of issuing a competitive RFQ or RFP and potentially bringing in another engineer into that mix, I think a good business decision was to approach Group 14 directly to carry on our 3rd phase EPC. And so that is why we procured it with this method. And so I'd like to take this opportunity also to introduce, I don't know if all of you had a chance to meet him, Michael Lopez. Michael Lopez is not just a brilliant construction project manager, he's a brilliant building scientist, and as far as energy performance of buildings, all things sustainability and green building. Michael worked directly for BSAG when they first started with Bill Sinkin and helped them produce their first BSAG program ever. And so he brings a lot of expertise. And so I'd like to introduce him. He's our construction project manager and green buildings and sustainability program manager. Michael, and if you want to add anything to this potential project.
Thank you, Hector. I just want to thank you for your advocacy and your leadership in our sustainability program. There's some real exciting things going on. Mike Reyes knows some of them, and we're going to be introducing these to you in the near future. Thank you so much.
Thank you.
I'm sorry, I failed to go through the slide presentation. We talked about the solicitation process, the financial impact. We're asking for a contract amount not to exceed $816,300. Be happy to take any questions.
Any questions? With no questions, I'll entertain a motion.
So moved.
We have a motion. Do I hear a second?
Second.
We have a motion and a second. All in favor, say aye.
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 Any opposed, same sign. Motion carries.
Thank you.
Thank you. Item 13, consideration and appropriate action regarding Resolution 6582, authorizing the expenditure of additional funds for lead removal at Lincoln Heights Courts and Riverside Apartments to Gerloff Company Incorporated for an amount not to exceed $300,567. George Ayala and Ruth Bautista.
Once again, Commissioners, today we're asking for your consideration and approving this particular resolution, which is allowing us to the additional expenditure of funds. A little background on this: on June 12th, we received board approval ratifying the award of a contract to Gerloff Company in the amount of $1.4 million for this project. This included an approximate 20% contingency in the amount of $240,454. On August 5th, we received a change order for this agreement and was issued in the amount of $107,442 with 72 cents to add an additional 44 doors to this project and painting of the 525 entry door jambs and inside casings. At this time, we're asking for you to allow us to extend our contract to the max of 25%, which is $300,567 to increase the window sill count from 663 to 1,951 window sills. As I mentioned, the financial impact is $300,567, which will be for the use of adding the additional window sills, bringing it up to a total of 1,951 window sills. Any question?
Any questions?
When is this expected to be finished?
That's a good question.
Hello, good afternoon, Commissioners. We're expecting the project to be done no later than July of 2025.
Thank you.
Thank you.
Any other questions? Being no questions, do I hear a motion?
Moved.
We have a motion. Do I hear a second?
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Any opposed, same sign. Motion carries. That is all our individual items. Before we adjourn, just want to thank all the residents who joined us here today. We bring these meetings to the property so that you can see in what happens within the organization that we live. And I say that we live because I live in housing also. So it gives you a chance to understand some of the things that go on and the work that the board does for us, the residents. So thank you for being here and sitting through this. And whenever you have questions, please feel free to reach out to your staff. And they're knowledgeable. If they don't have an answer, they can get with the staff and get you answered. So their staff is here for you. Also, I want to
Thanks, Dan.
Also, I want to thank the staff and the management of Fair Avenue Apartments for hosting us. you have a wonderful community room here, and I know that your residents are very involved in what goes on here on a daily basis. And you have a great resident council also. So keep engaging the residents and please, when they have issues or whatever, reach out to try to get these issues fixed. I hope that you all heard some of the issues that were talked about at the beginning of the meeting and that you all can work on getting those done. But thank you for hosting this meeting and having us here today.
Mr. Chairman, if I could just add to what you mentioned quickly on Michael Lopez is our sustainability colleague. We don't say it often, but Opportunity Home under his leadership has produced 1 million square feet of built San Antonio Green certified property or square footage in our portfolio. So that's impressive. We don't pat ourselves on the back often, but I just wanted to acknowledge. You mentioned it already, but I just wanted to repeat it. I wanted to thank our Fair Avenue staff. They're a great group of colleagues here. I visited them here before, and they're just a great group here, led by Demetra Peoples, the community manager, and of course our Director of Public Housing, Ruth Bautista, and our Assistant Director, Victoria Phoebus, who are great leaders at this community and across our portfolio. I wanted to also thank our resident council members here. This is a great resident council, very active, very robust. And so gracias por todo, gracias por venir. And the fourth item is I just wanted to thank our IT staff to making this event possible with the computer setups, the screen setups, and all the setups in the back. So thank you to the IT team as well. So thank you for allowing me to speak.
I know it takes a lot of time and effort to bring these meetings out into the public and know that I, myself, and the board appreciate all the work that you do for us to be able to bring these meetings out to the residents. Thank you. You're always welcome. Even back at central office, you're always welcome to attend the meetings. Mr. Chair, you have anything?
No, you covered.
Okay. Do I hear a motion to adjourn?
So moved.
We have a motion. Do I hear a second?
Second.
All in favor? Aye. Any opposed? Meeting adjourned.